recently psychiatric graduate from the University of Nairobi. Welcome to White Oak Medical Center. This is where I practice. I've been here for the last 2 years, and prior to that, I was at MP Shah. So now this is my area of practice. So I think the right place to start with will be how we define disability. So WHO, and if you allow me to read what the WHO definition of disability is, they say it's a continuing condition that results in a substantially reduced capacity in communication, learning, social interaction, or physical movement among others, and that necessitates continuous support in aids and services for the individual to sufficiently overcome the functional impairments. So with the definition of disability, you're seeing that disability is not restricted only to physical disability, but even a child who suffers from autism is considered disabled, right? So mental health is directly involved with disability. Mental health is the cause of disability as well. So as much as we say that, we also look at how physical disabled patients and mentally disabled patients, what affects them as well in the secondary aspect. So mental health and disability walk hand in hand, I would say that. If you look at the statistics, for example, according to WHO and Global Burden of Disease, from an estimate of 7 billion, a population of 7 billion in the world, about 800 million are significantly disabled, and 150 million are severely disabled. Now, if the patient is disabled, if we are looking at those numbers, from this, we're looking at it being 950 patients disabled, right? For each disabled person, if there is 1 or 2 caretakers, what would that end up being? 2 billion people? From 950 million? About a good 2 billion people that are affected. Isn't that a significant amount of persons affected as caregivers and as those who are affected? So yes, the rates do differ. A lot of times it also ends up being that the ones who are affected are left alone. So all of those things play into account when you're looking at the rates of those who are affected. These are people who are disabled. For example, if someone is unable to walk and is wheelchair bound and there's no one there for him, what is he going to do? How is he going to search for food if we left them on the streets? And we understand that. And I think that's where again we come to our statistics, that in our census we had only about 2.2 million people who are between 1.5 to 2.2 million people who are registered as disabled, while the postulated statistics are referring to a number of about 6 million. So if the postulated statistics are at 6 million, we do not have reliable data saying whether it's 2.2 million or it's 6 million. We will obviously take the 2.2 million one in a way for the country to look good. Two, we end up under-resourcing these people and not providing enough for them. So obviously they end up being on the streets. The caretaker does not have enough money to care for the person who is disabled. So leave them on the streets. When they're on the streets, are they really getting what they can? Are they achieving what they want? Are they getting food? Are they getting shelter? The core humanitarian requirements, are they getting them? Food, shelter, And if that does not affect their mental health, then they're Superman. They're already super people, but obviously the mental health, depression, anxiety, they'll start looking for things to take on the streets. That's where we start seeing dependence on drugs, because now they're alone, there's nothing. So you see people taking all these things like glue and sniffing glue and sniffing fumes from jet fumes and jet fumes and bang and all of that. It's because they are in need to find something to either satiate themselves or to find something to relieve themselves. We always expect good, and when it's not as we expect, there's always a reaction. You're bound to feel extra pressures, stress, financial constraints. All of these things will add up to you having a poor mental health status. So when it comes to mental health, the three statuses that we look at: good mental health status, poor mental health status, mental illness. We tend to, as a general population, we tend to be around anywhere between good and poor in waves. The days will be extremely stressed, that's poor mental health status. The days will be extremely happy, that's a good mental health status. So when the stresses are more, you are more towards the poor mental health status, which can then tip you over to mental illness. So a child born with disabilities, the parents will feel that pressure. And a lot of times, those ones who believe will even question God for this, right? So all of these things are present. A child needs love, a child needs care, a child needs understanding. As much as they need food, shelter, they need emotional support. The parent first has to come to an understanding and to acceptance. Once you accept that this is your child, once you accept that whatever you do, this is from you, and a child is a gift. When there is acceptance, there will be understanding. The parent will have to work on his own mental health first before they can even look or think on impacting the mental health of the child. If there is no acceptance from the parent, the child is going to suffer. So we have to focus on the parent's mental well-being as well as the child's, right? So they need to seek help. They need to find a support system. Seeking help, finding a support system is not bad. We have a lot of stigma around it, but we have to break that stigma. I think education and community education works brilliantly. Community-based rehabilitation works brilliantly for these kind of things, and we need to be active about it. They need to understand what the disability is. They need to accept the disability. They need to seek help themselves where they feel that they need help. As much as we talk about facilities and the government needs to organize easy to facilitate easy healthcare, universal healthcare, so that it's financially not a burden. But the parents themselves need to come in and understand that disability is not inability, and how to nurture that. When they do, when they have a support system, when they are in the right frame of mind, then they'll be able to serve the child to grow up and explain to the child and give motivation to the child. Different disabilities are different, and the consequences of disabilities can be varied. Some are physical disabilities, some are mental disabilities, and each of them will require different modes of understanding, different modes of treatment and management, and that would lead to different forms of stresses and different amounts of stress. If we can quantify stress. So I think the parents and the caregivers themselves have to be in a place where they accept, where there's acceptance. As an individual and as a society, we need to make that effort. We need to make that effort of integration. We need to make the effort of them not to feel inadequate. We need to make the effort of showing them that, like we say, disability is not an ability. We need to give them examples and we need to give them support. We need to avoid situations where they're bullied. We need to avoid bullying them. We need to avoid discriminating against them. If a person is qualified for a certain job just because he's on a wheelchair, should not be a reason that he doesn't get a job. We need to be more adaptive and accommodating. Special schools need to be given. A lot of our special schools are quite underfunded and under-resourced. So I think we need to work on that and to work on integrating the special schools with regular schools in a way that people come together. Be it in forms of sports, be it in forms of education, be it social interaction. We need to influence it and we need to direct it. It's not saying that we're doing a very shoddy job or we're being very bad at it. I'm sure everybody is working hard and putting in an effort. I know one of the most important things for us would be the universal healthcare system, which will help these people get medical, people with disabilities and the general population get affordable healthcare. And I know the president is pushing for it quite strongly for that. So I think that will also play a huge role in how we integrate and accept.
You are watching TV47, the home of untold stories. Upgrade your DSTV package to enjoy all the content you love. That means if you're on Access and you upgrade to Family, you get boosted to Compact. If you're on Family and you upgrade to Compact, you get boosted to Compact Plus. And if you're on Compact and you upgrade to Compact Plus, you get boosted all the way to Premium.
Sonadol Extra imetengenezwa kwa njia spesheli kupambana haraka na maumivu ya kichwa, mwili na hata meno. Sonadol Extra, hakika maumivu yakizidi, pata ushauri wa daktari.
You are watching TV47, the home of untold stories.
You'll find it difficult for a child with autism to fully integrate with regular children because he has deficiencies in understanding, in moods, and given our following instructions, and given our capacity to hold. I would say it's important to have the special schools, but it's important to integrate. With special schools, you're giving them directed education. You're finding out where there is a core, where there's an imbalance, and you're trying to give them and accommodate that imbalance and trying to cover it up and improve on it for every individual. We're severely short-staffed and under-resourced to try and accommodate everyone in one place. I would say we need to focus on improving the individuals as much as we're integrating them. Just integrating them and letting them be there are more chances of them being bullied and discriminated against. So I would say we need the special schools, but we need to find ways of integrating the special schools with the regular schools in certain areas. See academics, sports, any of these things. We are taking steps The Global Summit of Disability was held in Kenya in 2018, if I'm not mistaken, and there were certain recommendations that were made and certain steps that we as a country have decided to take up and to work towards for persons with disabilities, which included their mental well-being. But we're far. If you see someone with disabilities, doesn't mean that you can't go and just talk to them. I think the first thing that we need to do is be able to approach them, create conversation, talk to them, accept them. If we don't do that, then we're not going to be in a place where we understand them. A lot of times the discrimination comes in the form of huyu hawezi tembea, mbona niende huko, au kwa wheelchair, nani atamsaidia? Nikikaa hapo hivi kumsaidia itachukua muda wangu, nitachelewa. Nikikaa naye kuongea itafanya hivi. Unajua, we reach a point whereby all our understanding is based, we generalize their disability and just discriminate. So the most important thing for us is not to discriminate, to accept. All of these, anxiety, depression, stress, drug abuse, because so all of these can cause you to go from poor mental health status to mental illness. I'll give you an example. So a caregiver is taking care of a person with disability. Poverty, a lot of them are, according to our census, majority were in rural areas, so poverty is there. So they're poor, they can barely afford to put food on the table. He's taking care, he's really exhausted, stressed out, does not understand why the disability is there, why he has to be the one to take care of the person with disability. He might be the parent, he's very frustrated. The only thing he can think of is, okay, I need to relax. Go take changa, go have easy drinks to try and relax. He gets into alcoholism. So now you have stress, anxiety, depression, and drug abuse. Hasn't that affected your mental health in totality? Haven't you become from poor mental health status to the verge of mental illness? We need to get proper data, reliable data. If we're able to get reliable data, we will then be able to get the right funding, the right resources, to improve on their healthcare. 2, universal healthcare. They're able to. People with disabilities should be able to get healthcare at an affordable prices. Not even people with disabilities, everybody should be able to get affordable healthcare. And I think we're working towards that. And as we work towards that, it will be able to facilitate, the government should be able to easily facilitate these services. The resources should be used in the right way by the right people to ensure that. We need to focus on community-based rehabilitation. So the government has to start, increasing the knowledge and improving on the education. And once we do that, then we can start, once we educate the community, there will be acceptance. And the government has to play a huge role in that. Then as an individual, we'll be able to do it as well. We need more psychiatrists, we need more psychologists, we need more mental health specialists to come into the picture, because for a population of, what's our current population, 40 million? Yes. From the last census? The last time I checked, we're about 100 psychiatrists. 130, out of which 120 or 100 are practicing. Is that enough? For 40 million, 100, that's what's the ratio, 400,000 to 1? It's not enough. Psychologists, we need to use psychologists. We need to be able to employ. I think the tide is changing. Mental health is becoming a big issue when it comes to the whole world. COVID-19 has accelerated that. So I think we need to ride the tide. We need to jump in and accept that mental health is going to be the biggest thing. Seek help where you need to. Don't feel that you're alone. There's always someone there to give you a hand, to talk about, to understand. It's not easy, but we need to work together. People with disability can be the brightest stars in our future. We've seen that. We've seen multiple people watching the World Cup saw that child without legs, the boy without legs who spoke to, I think, what was the other man who was there in the opening ceremony of the World Cup. And when you follow him up, he has been having disability since a child, but now he's climbed mountains. He swims in competitions. Has not stopped him from going anywhere. Those are inspirations. And I think we need to focus our minds on trying to get the people with disabilities better, but do not forget yourself. Do not forget your mental health. Work on your mental health as well. Do it to yourself every day. Spend 10-15 minutes. Have a checklist. Have I exercised today? Did I do my breathing exercises today? Did I take a walk and appreciate what was around me today? Did I do anything for my mental well-being, for my mental health, for my happiness? Tick those boxes and then decide. It's a daily thing. Mental health, it's not about taking antibiotics and you'll be better after 5 days. It's about working on your mental health every single day, giving time to yourself every single day, meditating every single day. It's a daily thing, it's a daily checklist. And it's not hard. It's 15 minutes of your time, half an hour of your time in a day. That's it. Prioritize mental health. That's the problem, right? We prioritize everything else over mental health. When you're sick, you will go to a doctor, whatever it takes. When you land in jail, you're going to a lawyer, whatever it takes. Because you prioritize that. Prioritize mental health. Making it affordable, I think, will come in with help of the government, with help of the individuals. See, if we start working towards it, then everything is possible. But it has to be a joint effort between the government, the doctors, the medical community in itself. You can't expect, and I'll come and say that, you can't expect the doctor to say, oh, I'll give free consultations and will be free of charge, or it'll be minimalistic earning, and then they provide the services without having any remuneration on their part. It's not fair. Then their mental health is the one that you're compromising. So where are we standing? Where are we drawing the line? I think it has to be an understanding. And I don't think the medical community is very bad. I think when we're approached, we are always ready to help. But it has to be an understanding where everyone comes to the picture and comes to the party. Persons with disability is not inability. You have got what you've got. Make the best of it. Seek help where you need to. Caregivers, we do know that there's a huge burden on you taking care of the persons with disabilities, but don't forget yourselves. Seek help where you need to. Try making time for yourselves every day. Make sure you're making some time for yourself, for your health every day. You'll not be of help to the person if you're not well yourself. So make sure you're making time for yourself. Make sure you're taking care of your health. Seek help where you need to. Counseling, understanding of what the person with disability is going through to help you accommodate and understand them better. I am at White Oak Medical Center, Spring Valley.